Hello, everyone. Welcome to Munson Healthcare's COVID-19 press conference. My name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. Today is Tuesday, February 8th, 2022. And before I introduce today's speakers, I do want to remind everyone that we will have a Q&A session at the end of our panelist presentations today. If you are a reporter joining us directly through Zoom, you can submit your question that way. And we're excited to have all of you joining us live on Facebook. If you would like your questions considered and answered, please submit them directly through Facebook, and we'll get to as many questions as possible within our 45-minute time period today. Joining us today as speakers will be Dr. Christine Nefcy, the Chief Medical Officer for Munson Healthcare. And then joining us also this week will be our health department experts. First, you'll be hearing from Wendy Hirshenberger, the health officer with the Grand Traverse County Health Department. Next, you'll hear from Lisa Peacock, who is the health officer of the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. And also joining us will be Dr. Jennifer Morse, the Medical Director of District Health Department number 10. So let's get started. It's my pleasure to welcome back Dr. Christine Nefcy, Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefcy.
Thanks, Diane. All right, so let's go into our numbers. And as always, we'll start with the state. So you can see there on that bottom left-hand block that we are at a 22.9% positivity rate. So we are seeing a slow but steady decline in the state percent positivity. And again, if you look at that very lower number, that 19.8%, that to us is an indication that we will continue to see that number trend down. 22% is still high, but certainly trending in the right direction. Next slide. And we in Northern Michigan, we think are a couple weeks behind the state. So we are at a 25.5% positivity. Again, a slow trend down in the last four updates that we have gotten. So we like to see a little bit of a longer trend line going down there before we call it good. But if you look at that 24.1% underneath, that again is an indication that we will likely continue to see that slow trend down. So still quite high, but going in the right direction. Next slide. And there you can just see kind of that graphic representation, our big long surge there for Delta, a decrease, and then really holding steady here on our inpatient numbers with this latest surge. Next slide. These are our numbers as of this morning. So we have 71 patients hospitalized with COVID-19. 23 of them are vaccinated. 48 of them are unvaccinated. And then as you get into our sicker patients, of those in our ICU and on the ventilators, you can see again, the vast majority of those patients are unvaccinated. Next slide. This is just sort of a further indication when we look at the data of not only the benefit of being vaccinated, but also the benefit of being boosted. So when you look at these trend lines here, just to kind of take note there of how many people per 100 are boosted, and you can see the United States is fairly low when you look at that compared to other countries. And if you'll go to the next slide, compare that to our deaths per million, the United States is quite high compared to that. So some of that is related to probably the relative poor health of the US in regards to obesity and that kind of thing. Risk factors we know are relevant for COVID-19, but we do think a lot of that is also related to the percent of our population that has been vaccinated and boosted. Next slide. And there you can see again, fully vaccinated versus unvaccinated, that trend line. So a stark difference in your risk of hospitalization. Next slide. And we do continue to follow influenza. So still just a handful of cases here in Northern Michigan, which is good news for us, but something we continue to follow as we are still in our flu season. Next slide. So Another reminder about vaccination really being the best option, not only to avoid hospitalization with COVID-19, but serious illness and potentially death. As a reminder, our supply for monoclonal antibody is extremely limited, and the demand for that far exceeds what we have on hand. Slide.
Thanks, Dr. Nefcy. Appreciate you sharing the current numbers with us, and it's optimistic to think that we may be on a downward trend. So please stick around and we'll have you back shortly for the Q&A session. Next, it's my pleasure to welcome back Wendy Hirshenberger, who is the health officer with the Grand Traverse County Health Department. Welcome back, Wendy.
Thank you. All right, so we will continue the potential positive news, and that we as well in Grand Traverse County are starting to see that downward trend. You can see that although January was our highest number of reported cases for a month with just under 3,700, since then we have seen a kind of slow, steady decrease. I do want to acknowledge the fact that home antigen tests are sort of sporadically reported by people. So it's not a requirement that they're reported. And so those numbers aren't in the counts. And so the degree of the decline is a little bit harder for us to assess, in all honesty, just because we know that there's people who are positive for COVID out there that just aren't reportable or reporting cases. So just keep that in mind. When we look at our last 7 days, we've had just under 400 new cases and 3 deaths. We're averaging 57 cases per day for the last week. We were triple that about 3 weeks ago. Our percent positivity is also down from the 30% plus mark in the last few weeks, and we're down at 23.5%. Although we've seen a slight uptick, a very small number on the deaths. We've had 4 in the last 2 weeks. We're still significantly lower than we were in December, and also seeing a decrease in the number of people coming in for vaccinations or boosters. So overall, downward trend. Next slide, please. And this graph just shows kind of the surge that we saw this fall. This is a 3-month graph. So you can see the high number for, it was about January 25th is where our peak. And since then, we're starting to see that steady decline. So we still do have high transmission. We're still at a higher case rate of 516 per 100,000 population, but it's still a lot lower when we were actually about 2.5 times that in the last few weeks. Next slide. We talked about vaccinations, and I think Dr. Nefcy's slides really showed the benefits of being vaccinated if you do get COVID. And so this is just information that we're still vaccinating 4 days a week at our Cherryland Mall Clinic. It's walk-in, so no need to make an appointment anymore. It's Tuesday, Wednesday, Thursday, and Sundays. So if you can't get there during the work week, we do have Sunday options open, and you can get first dose, boosters, anything at that site. Next slide, please. We're also continuing our testing at our Airport Access Road location. The testing is 4 days a week, so Monday, Wednesday, Thursday, and Friday. You do need appointments for that testing, and it's a combination of antigen and PCR testing. So we do have that. The clinicians will make the determination if a PCR test is warranted. And then if you go to our next slide, you'll see that on the Tuesdays that we're not testing at that same location, we are distributing KN95 masks. These are important, particularly during high transmission and with Omicron, as masks are something that are proven to help protect people. There was a new study that it came out, and I have a little summary slide of the results that really shows by wearing a mask, you lower the odds of you testing positive for COVID. And so you can see, depending on what kind of mask you're wearing, a cloth versus surgical or the respiratory N95 or KN95, the better the mask, I guess, the lower your chances are of testing positive. So this is an important study that came out just because the previous ones most of us have seen were really focused on using masks for source control. So protecting others when you wore that mask. And so this is something a lot of people have been wondering about for quite a long time, and we get questions about that. So if I wear a mask, is it protecting me? Yes, it clearly is. Next slide. This is just a reminder. So with the prolonged surge and the fact that we're starting to transition a little overall in public health as a whole, that we no longer are doing individual case investigations and contact tracing. We're really focused on kind of the high risk type settings, and just ask that if people test positive, they identify who they may have been around for 15 minutes or longer. They let those people know, and that people take the appropriate actions with isolation and quarantine. That information, if you go to the next slide, is on our website. I think it's on most local health departments' websites, where there are links to if you've been exposed, what to do. If you go to the next slide, this is just a quick screenshot of those 3 links. It's very easy, simple instructions, what to do if you test positive, what to do if you're exposed. And then it also helps people understand how we count as far as when you've been exposed, and then how do you count the number of days, and where's the end date for isolation and quarantine.
Thank you, Wendy. Wendy, we will ask you to rejoin us for the Q&A session after the rest of our panelists are able to speak. So, and again, as always, thanks to Wendy and her team for all of their continued efforts. Next, I'd like to welcome back Lisa Peacock, the health officer with the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome back, Lisa.
Thanks, Diane. So I'll talk about each health department separately in just a moment, but just in general, looking at case rates and positivity rates, in the state of Michigan from January 18th to February 3rd, the weekly cases per 100,000 decreased by 57%. As Wendy said, certainly more tests are being done at home and not reported like other tests. So, that is certainly qualified by that. But I think we are seeing just the general trending of things starting to move downward, which we're all optimistic about. And then in the Traverse City region, our Merck Region 6, the same time period, we had a decrease by 44% of weekly cases per 100,000. So we're both definitely seeing that trend in both health departments as well. Vaccination uptake over the past week has been a little slower than we'd like to see it, even stagnant in some age groups. And so we really want everyone to know that we have, wide availability of vaccination appointments, and we're trying to make it as easy as possible for people to get out there and get vaccinated. So in particular, the Benzie-Leelanau District Health Department, some shifts and information for this week are that we continue to have our contract with the HANU Management Group to do testing on a walk-in basis, both in Leelanau County at the VFW Hall in Lake Leelanau and the Paul Oliver Hospital in Frankfurt. And so those are really good opportunities for people to walk in. You get a rapid test and or a PCR depending on your needs. And the turnaround time is improving with less demand on testing, but we're still doing a lot of testing at those sites. Vaccination clinics are available for 5 to 17-year-olds and those 12 and older. Both age groups can schedule very easily at our website, self-scheduling online. We are doing KN95 distribution at both of our health department offices, and also working with community partners to get some of those KN95 masks out into the community. And Wendy just showed that great slide showing how effective they are in protecting the person who's wearing them. So that is definitely recommended while we still have widespread community transmission. And then one other shift, as we've moved away from universal case investigation and contact tracing, our public health professionals are more available to help people who would like to reach out to us for help. So we want the community to know that they can call 882-2197. And that is being answered live during business hours by a public health professional. So if you have questions about what to do if you test positive on a home test, or you have questions about isolation, quarantine, returning to work or school, we're ready and waiting to take those questions for you. Go to the next slide. Much of the same information for the Health Department of Northwest Michigan. We are still doing weekly testing with the HANU lab as well. And so you can go to our website to find those sites. We have one in Gaylord on Mondays, one in Central Lake on Thursdays, and one site in Charlevoix on Saturdays, and soon to be starting testing in Emmett County on Sundays through HANU. So all of that information is up to date on our website. Vaccination clinics are now combined. So children and adults are all being seen in the same clinics in our health department buildings for the most part, with some community clinics. You can call our 800 number listed here for assistance. And you can self-schedule on our website very easily as usual. And like I said, we have lots of availability. So please, feel free to take advantage of that opportunity. We are distributing KN95s in all of our health department offices in the Northwest District as well, and have also partnered with community partners to get these out into the community, including emergency management services, some of our libraries and pantries, and some churches. So those are widely available. In some of our counties, they're going quicker than others, but you can just stop in anytime during business hours, 8 to 5, 5 days a week. We have also pivoted some of our public health professionals who had been doing case investigation and contact tracing to answer our live public health information line. And that number is 1-800-386-5959 for those in Antrim, Charlevoix, Emmett, and Otsego counties. And then next slide. One thing we're really excited about at the Health Department of Northwest Michigan is, as part of our lab expansion, our Northern Michigan Regional Lab in Gaylord, we've been able to purchase a mobile unit, which will allow us to do a lot of services for the community and take it on the road. And so currently we've had a lot of demand for testing in Emmett County that we have had difficulty meeting over the past couple of months. And so the past couple of weeks, we have been taking that mobile unit up there to the Emmett County Fairgrounds. We've been to Mackinac City. This week, we're going to Boyne Mountain, and we have a team that is exclusively doing testing through the mobile unit. And then those results are being run in our Northern Michigan Regional Lab with a turnaround time within 24 to 48 hours, usually on the shorter end of that. So we're excited for the future possibilities of this mobile unit, including, bringing our services on the road like vaccination and WIC, and, there's lots of possibilities. So I will stop there.
Great. Thank you so much, Lisa. It's so exciting to see the new mobile units. Congratulations on those. And thank you again to you and your teams for everything that you continue to do to help us. Great. We'll have you back in a moment for the Q&A session. We do want to get to our last panelist today, welcoming back Dr. Jennifer Morse, who is the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Thanks. So as everyone else had mentioned, our cases have been decreasing as well just for the last week. So hopefully that trend will continue, and our percent positivity has decreased slightly as well, but still cases and percent positivity are still quite high, but we are cautiously optimistic. Next slide. We continue to have testing in 7 of our 10 counties. Not listed here is our Grayling site. That is run at the Kirtland Community College. Overall, since these testing sites have started, our testing positivity is in the upper 20s to 30% positive. Recently, percent positivity has been going down some, and over the last week, the number of individuals arriving for testing has been decreasing. Hard to know, as others have mentioned. The availability of home tests have increased, and also the weather hasn't been the greatest. So we'll continue to watch to see if the demand for testing decreases. We have no intention of stopping the availability of these sites, however, but we will continue to watch that. And we are working to get a site up in Manistee. So again, we continue to work on making sure testing is available. Next slide. So our vaccination rates continue to hold pretty steady for our counties. Again, we still have vaccination readily available in all of our health departments, as others have mentioned. As a reminder, it's also available in most pharmacies, and many healthcare providers have it available. As a reminder, you can go to vaccine.gov, to find vaccination sites anywhere, both health departments and pharmacies and other locations. So just a reminder there. Next slide. Our childhood vaccination rates hold pretty steady at right around 16% for the 5 to 11-year-olds. So we would love to see that higher. We still have that available as well. So please consider getting your child vaccinated. And again, you can schedule that in our offices at the dht10.org/schedule, or you can call our central scheduling number, which is also available on our website. You can report your home test on our website. It is not mandatory, but we are keeping congregate or aggregate counts just so we can keep track of that. But also we do provide links for education and resources on how to notify your close contacts through that link. It's right on our home site at dht10.org. And all of our other resources are on the various links that are listed there. So I believe that's my last slide.
Great. Thank you, Dr. Morse. And thank you and your teams for everything you're continuing to do. That's wonderful. So now I'd like to ask all of our panelists to rejoin us with their cameras and audio for our Q&A session. As a reminder, if you are a reporter joining us through Zoom, please submit your question that way. And if you're joining us live on Facebook, just submit it live on Facebook and we'll get to as many as we can. Our first question is for Dr. Nefcy. You mentioned that the supply of monoclonal antibodies is extremely limited. What about the supply of the Pfizer and Merck antiviral pills?
Yeah, that's a great question. And Paxlovid, which would be the antiviral we would recommend, is certainly available. There are some restrictions on it as far as tiering for those that are the highest priority for getting the sickest from COVID. We did just hear from the state this week that they are looking at potentially loosening that a little bit and looking at distributing it a little bit differently than they are currently so that we can get it out to more people. But we have, I think, a better supply of that than we do of a monoclonal antibody for sure.
Thanks, Dr. Nefcy. This next question is for you as well, and I think it's very timely given the meeting we just came from. The question is the hospital still in level red status with the steady decline in hospitalizations? And if so, when do you think it will be safe to lower that status?
It's a great question. And one that we are already having a conversation about. Just as a reminder, when we look at that pandemic response plan, and again, this is a broad pandemic response plan, it's not specific to COVID, we look at certain metrics and different things in different categories before we make that decision. And one of the things is our case count and our percent positivity. So pandemic level red says a 20% positivity or higher. Again, we're at about 25% right now. And 200 or more new cases per week, and we are well above that as well. That being said, we are certainly seeing improvement, and we try not to, wait until we reach a certain point and look at the bigger picture. But we are seeing the numbers trend down towards where we would be for orange. We are monitoring the data and ensuring that we are absolutely trending in that right direction before, we pull that trigger, so to speak. But we are definitely looking at that as a possibility as we continue to trend in the right direction.
And on a related note to that, when we do decide to make the move back to orange, there will be a lot of communication around that, including if that implies any changes to our visitor policies or any other affects any other patient care. So we'll keep you informed as we make those decisions. This next question is for Wendy, and I'm going to give this one to you because you had the great slide with the new information on masks in the study. The question is, so would you now recommend people always wear N95s when out and about? And what about children? Should they be wearing respirator masks too?
Good questions. I think for quite some time, particularly with Omicron, we have been recommending that people wear at least surgical mask or KN95s when out in the public. And based upon the slide that we showed, with the decreasing your odds of 56% if you're wearing a cloth mask, or 66% for surgical, or 83% for the KN95 or N95, I think what that does is allows people to look at those numbers and make a determination of what level of risk they're willing to make when they're out in public. So clearly a mask in general, whether it's cloth or higher, is effective in helping to protect them. So now it's really up to the individual. And with mask, what's most important is that you consistently wear it, that you're not constantly touching it or adjusting it, and that it is something that you can tolerate and you can wear. So it's really now really up to the individual to determine like what's going to work best for them and their children.
Thanks, Wendy. I think that's a really great overview. On a related comment that we received, someone just made the comment that I've heard people complain that the N95s are uncomfortable. So what would you recommend in that case, that they select a different type of mask but wear something?
There's multiple different kinds of KN95. I know myself, I have about 3 different options that I can wear. And really it is about finding one that's comfortable and it's a good fit for your face. Like, we all don't have the same face shape. So, if you can, if you don't have a choice, I would say that, just making sure you're wearing it when you're in the high risk situations where there's going to be a lot of people, and that you're not aware of their vaccination status, you're not aware of, what other risks might be there. So.
Great. Thank you, Wendy. Appreciate that overview. This next question, I'm going to ask Dr. Morse to comment on first. Is it pretty conclusive at this point that COVID-19 will become endemic in the population even after the latest wave subsides? And if that's the case, what may that look like moving forward?
First, I just wanted to add to the mask statement.
Sure.
Just wearing a cloth mask alone cuts your risk in half. So I just want to point that out, that I don't want people to feel like, well, gosh, I can't afford or I don't have access to a comfortable KN95, therefore I won't wear anything. So just to keep that in mind, that data at least shows that just a cloth mask alone cuts your risks in half. So, so it's better than nothing. So yes, we will see COVID becoming endemic. One of the main reasons is that it is what we call a zoonotic illness. So it does cross over into the animal population, not hugely, but even if we were to eradicate it from humans, it can cross over to animals. So we can't completely get rid of it, is basically the issue. I really don't like making predictions of what will this look like, because no matter what people have tried to predict with COVID, I don't think really followed anyone's predictions. But I think what we're hoping it'll be is we'll find some kind of a seasonal pattern to it, like other viruses, where it'll get worse in the winter and fall and then get better in the summer and spring, or something to that matter, where we'll find how often we might need booster shots, if we do need more booster shots. That kind of a thing, so that we know basically how to handle it long term. It really hasn't fallen into that kind of a pattern yet. So we're just kind of waiting for that bouncing ball to get into a steady pattern, really. But it will become endemic. It will hopefully develop some kind of a pattern. But we've seen with SARS viruses in the past, it makes new variants, and we just have to be ready for adaptation and change and uncertainty.
Well said. Thank you, Dr. Morse. Appreciate that overview as well. The next question is for Lisa Peacock. It says only 10 counties out of the 83 in Michigan still have health department mandated mask policies for schools, and the Health Department of Northwest Michigan is one of those. Since there's only a handful of counties left with a mandate, is the health department thinking about lifting that mask mandate?
Great question. And also a topic that we've been discussing a lot recently. Yes, we are looking at the circumstances that we need to remove the mask mandate. Certainly when you already have a mandate in place and you're in the middle of a surge and our hospital systems are very fragile, that has been a situation where it hasn't been appropriate or safe to remove a protective measure. However, as we see those circumstances changing, we are definitely talking about that. The mask mandate was always intended to be temporary. It was always intended to be utilized when we have epidemic conditions that require that safety measure to be in place. And so the things that we're looking at are watching the cases and hospitalizations trend downward. Hospitalizations did not peak as high as cases did. So that's great news, something that we were hoping for, but now, we see that happening. We are probably a week out from being comfortable knowing maybe the trend that deaths are going to take following those hospitalizations. It's a little bit more of a lagging indicator. And so taking this week just to kind of watch and see what happens with deaths. A couple of other points that are, we're considering in all of this is that our school superintendents who have been operating under this mask mandate for the entire school year so far have asked us for a little bit of notice of when we would be lifting it, not much, but at least a week or so that they can begin to prepare their staff and families and boards and make their policy changes that need to be made related to the mask mandate. And then really just recognizing that parents have had ample opportunity for their children to get vaccinated. Now, that was a big part of the picture when we first issued the mask mandate, is that, the large group of students were largely unprotected and not able to be vaccinated yet. So because of all those things, we really are at a point where we're looking at that in the very near future. I imagine by the end of the week, we'll know, what direction we're taking, and hopefully we'll be able to make an announcement that we'll be lifting it about a week later or so. So that's what we're hoping for. That's what everything is looking like, and you'll likely be hearing more.
Great, thanks, Lisa. We look forward to learning more about that decision. Next question is for Dr. Nefcy from one of our reporters. We've been holding relatively steady with our hospitalization numbers as of lately. Would you say that this is a trend, and what might be causing that trend?
Well, I think that we know with the Omicron variant that while it is much more contagious, the lethality is a lot less. And, we at the same time put in some mitigation factors and have a relatively high vaccination rates here in our region. So, it's really hard. And I think it would be nice if we could just say it's one thing and pinpoint, but it really is a lot of different things. This is highly complex, as all infectious disease and epidemiology is, but it's probably a combination of those factors. And, we are grateful that we are holding steady and hope that we continue to trend down.
And Dr. Nefcy, on a related question, how do the Munson Healthcare hospitalization numbers compare to other areas of the state?
Well, I think I mentioned earlier, we are trending a little bit behind the state. So they saw their numbers drop before we did. We tend to see hospitalizations and deaths lag behind the percent positivity by a couple of weeks. So we think we are continuing to follow the trend that the state is. If you looked at the gap in, their day percent positivity versus their 7-week average, they're a little ahead of us in that game. So we think that we're going to follow them. We hope that we're going to follow them in continuing to trend down. But that's where we are. But again, I can't stress enough, we still are quite high, and the hospitalizations are still higher than what we would like to see. So, that long ago we had that conversation of flattening the curve and trying to keep those hospitalizations down. That's still relevant for us here in Munson Healthcare.
Thanks, Dr. Nefcy. This next question is also from a reporter, and Wendy, I'll have you begin on commenting on this one. How much would you attribute the decrease in cases to your department's not doing as much contact tracing?
Sure, I unmute before I answer the question. I think that's a great question. I would say there's some I would say we can attribute some of it to not as robust individual case investigation and contact tracing, and some also to the abundance of home testing that's happening now. And, you know, some people are reporting, like Dr. Morse indicated, I think we all have portals that people can report, and we are still tracking that aggregately for our knowledge, just so we have a general idea of those numbers too. So the numbers right now, I think they're not perfect. So they're not, you know, as an epidemiologist, like they're not as pure as maybe they were in the past, but I would say that the numbers throughout the entire pandemic haven't been perfect. There's been a lot of people who have probably been positive that either didn't get tested or tested at home once that was available. So for us now, it's really just looking for indicators and looking for trends like we do with some other diseases. So, you know, we'll continue to really look at all the indicators, including our testing sites, like how much of a demand is there for the testing. That's a great indicator. And then again, looking at the lagging indicators of hospitalizations and deaths, and all those things help steer us from a public health perspective of kind of where we're heading and where the overall trends are.
Thanks, Wendy. I'm not sure if anyone else wants to comment on that. Otherwise, we'll move to the next question. Wendy, I'd also like you to begin commenting on this one as well. We recently hit 900,000 deaths since the start of the pandemic nationally. How does this number compare to the number of deaths regionally?
Well, I mean, by just comparing sheer numbers, obviously, you can't compare, right? If we're talking about death rate, I don't know that I have that off the top of my head, but you know, it's going to be somewhat dependent upon individuals and kind of their health status. So that is something maybe we could take a look at, but I don't know, maybe Dr. Nefcy knows this one.
So I can tell you from a regional perspective, cumulatively, as of this morning, we had 1,736 deaths in our Northern Michigan region. So obviously, you know, small compared to the 900,000 we've seen nationwide, but certainly impactful for us here. You know, those are all people, neighbors, friends, family members. So you know, we get lost sometimes in some of these numbers, but I think it's important to remember and sometimes reflect on the impact that this pandemic has had on us and, you know, individual families. So that's where we are. I think from a mortality rate, what we're seeing is a slow decline as we see variants like Omicron, which are less lethal and more contagious. So, you know, when we started out, it was quite a high mortality rate that we saw. What we're seeing, the last I saw, was about a 1.5% mortality rate. As a comparison with influenza annually, we tend to see about a 0.1% mortality rate. So much less than what we were seeing earlier in the pandemic with a more lethal variant, but certainly still impactful, much more so than influenza.
Thanks, Dr. Nefcy. Lisa, I'm going to ask you to comment on this next question. I believe you and Wendy both mentioned that your health departments are handing out the N95s or KN95s. Can you comment on why you're doing that now?
Yeah, well, we just received a supply, so we got access to a supply that we haven't had before. And so, you know, they asked us if we would be interested in distributing, and we said yes, well, of course. And so we quickly, you know, got those out to community partners and to our various offices to make sure that they could get into the hands of the public who need them. So we're happy always to be involved in, you know, anything that helps our public be able to implement the mitigation measures that we all need to be doing right now. So.
And I assume it is also related to the way that Omicron is spread, that may be different than we saw with the Delta variant.
Oh, yeah, definitely, for sure. The transmissibility of Omicron compared to previous variants. Omicron is as transmissible almost as the measles, which is one of the most contagious diseases that we know of. Much more transmissible than Delta and much more transmissible than the initial variant or the Alpha variant. So that upgrading the masks is important right now because it is a more transmissible variant, and the better, the thicker protection, the way it fits better to your face, just like the data that Wendy shared, it's important right now. So we want equity. We want everybody to have access to that higher grade mask so they can be more protected.
Thank you, Lisa. And on a related topic of transmissibility and infection and reinfection, Dr. Morse, I'm going to ask you to comment on this question. There's a comment about a lot of people being infected recently due to Omicron. Is there any data that we have that we can share that will indicate how likely it is or when someone may be reinfected? And is that being vaccinated, does that lower your chances of being reinfected?
So the latest data that I have seen, both vaccination and recent infections, so within the last 3 to 6 months, do protect you from infection. Those that have been infected and then get vaccinated seem to have the lowest risk of reinfection. I have to admit, I'm not hugely up to date on all that research. I haven't, dug deeply into it, but, both infection and vaccination do protect you. Again, it's the longevity of protection from an infection is so variable from person to person. That is why vaccination after infection is still recommended. And that has been shown to be very, very protective. The protection from infection, kind of a tongue twister, but the protection from infection also comes with the risks of infection, which can be hospitalization, death, and long COVID. So persistent symptoms, which does occur in a large percentage of people who get sick. So, that's something to consider for those who may be relying on infection for their immunity.
Thanks, Dr. Morse. Next question is for Dr. Nefcy. You consistently report out on case numbers, every one of these press conferences. Is there still value in reporting case counts if a lot of people are getting at-home tests and not reporting their results?
Yes, I think that reflects back to what Wendy was saying. It still gives us a picture, right? And we don't look at just one thing or one number. We look at the, not only the percent positivity and the new cases, how many people are being tested, how many people are hospitalized, what our death rate is, what our employee infection rate is, and that absenteeism. So it's a broad picture, and I think it still gives us a reflection of what's going on in our community. So, while they're not perfect, they still are helpful, I think, for us in making decisions about things like whether we're still at red or whether we should still have mask mandates in place, whether we should be masking in high-risk areas, and whether people that are at the highest risk, being immunocompromised, should still be cocooning and taking care.
Thanks, Dr. Nefcy. This is another question for Dr. Nefcy specific to Munson Healthcare. Are fully vaccinated people with boosters allowed to volunteer while we're in pandemic level red?
No, I think that we are taking things on a case-by-case basis as far as anything from volunteers to students and all of those things. And if they are really necessary to the operation of the hospital and helpful, certainly we do have a mask requirement in place as well as a vaccine requirement in place. So I would, if you are a volunteer, first of all, thank you. And, I would reach out through HR and ask that question for each Munson Healthcare hospital.
Great, thanks, Dr. Nefcy. Unfortunately, we are out of time today. I'm sorry that we did not get to all of the questions that were submitted, but we will take a look at them and determine if we need to update any of our FAQs on our website. We will also have another press conference next week. The health department experts will not be joining us, but we will have some Munson Healthcare representatives available to answer your questions. And I just want to thank again, Dr. Morse, Dr. Nefcy, Wendy Hirshenberger, and Lisa Peacock for joining us. It's always great to hear your updates as we progress through this together. So thank you again. And just a reminder of some of our community resources. You've heard from all the local health departments today. Here's their contact information again, but I do always like to point out vaccines.gov is a great resource, as well as 211 Michigan and the Area Agency on Aging of Northwest Michigan. Next slide, please. As a reminder, if you are looking for COVID-19 testing, and especially if you have symptoms, please seek out testing to know whether or not it is COVID, and then what your next steps are. You can look to our local health departments, your primary care provider, retail pharmacies, and then also the michigan.gov/coronavirus website has testing resources listed, as well as the Michigan COVID-19 hotline. And as always, you can call the Munson Healthcare Ask a Nurse hotline. And there are some free tests available that you can order online for you and your families. Family members, I believe you can order 4 per household at one time, and that you can go to covidtests.org, and those tests are free and will be mail delivered to you. We invite you to join us on Facebook, LinkedIn, Instagram, Twitter, and watch our YouTube channel for the latest information. Also sign up for our biweekly e-newsletter, and visit us at munsonhealthcare.org. But again, as always, if you have COVID-19 questions about vaccinations, your symptoms, whether or not you should see a doctor, or general health questions, you can always use our Ask a Nurse hotline at 231-935-0951. So again, thank you for all of the reporters who joined us on this Zoom call. And as always, we're just excited to have all of you join us live on Facebook as well. Thank you for your time. Stay safe and healthy, and we'll see you again next Tuesday.